A migraine is usually a severe headache felt as a throbbing pain at the front or on one side of the head. Some people also have other symptoms, such as nausea and sensitivity to light. Migraine is a common health condition, affecting about 1 in 10 people in the UK. There are several types of migraine, including migraine with aura. This is when there is a warning sign known as an aura before the migraine begins. About a third of people with migraine have this. Warning signs may include visual problems, such as flashing lights and stiffness in the neck, shoulders and limbs. Migraine without aura is a relatively new name for the most common type of migraine headache. Another name you might hear is common migraine. These migraines don't have an aura. Migraine without headache, also known as silent migraine, is when an aura or other migraine symptoms are experienced, but a headache does not develop. Migraines affect 1 in 4 women and 1 in 12 men in the UK. This is roughly 15% of the adult population. Hormones may be the reason why migraines affect more women than men. For example, some women find that migraine attacks are more frequent around the time of their period. However, this association has not yet been proven. Migraines usually begin in young adults. About 9 in 10 have their first migraine before they're 40 years old. However, it's possible for migraines to begin later in life. Everyone will experience migraines differently. Some people have attacks frequently, up to several times a week. Other people only have a migraine occasionally. It is possible for years to pass between migraine attacks. Some people find that migraine attacks are associated with certain triggers, which can include stress and certain foods. In this programme, we look at the latest innovations in migraine treatment and hear the views of family GP and television personality Dr Chris Steele, and we visit John Radcliffe Hospital in Oxford to hear expert views on chronic migraine treatment from Dr Paul Davies, Senior Lecturer in Clinical Neurology, and Alexander Green, Consultant Neurosurgeon.
Migraine is a condition where the patient suffers severe, intense headaches, often just on one side of the head, can be associated with all sorts of other symptoms. They may get a warning beforehand, a disturbance of the vision beforehand. They may get nausea and vomiting. And they may find that the light annoys them or noise annoys them. And many patients with migraine will know from experience that they just feel better if they lie down in a quiet room that's darkened and take simple painkillers until the migraine passes. Yeah, many people will say, oh, migraine is just a headache. Listen, let me tell you, if you're a migraine sufferer, you don't want people having that attitude, right? Migraine is a severe, disabling headache that stops you going through your daily routine. And migraine can be triggered by so many things out there. It could be coffee, it could be cheese, it could be stress, it could be oversleeping, it could be no sleep. There are many, many different triggers, and people respond to different triggers that fire off the migraine. So never think that migraine is just a common or garden headache. It's far more than that. Patients with migraine can treat themselves. Many of them find that a certain combination of painkillers can help them, paracetamol and codeine. It's interesting because patients with migraine will try many different treatments, and they may find one that suits them personally that they can buy over the counter. There are treatments that will ease the pain and also bring the circulation to the brain and the head back to a normal state. There are more powerful treatments that are available on prescription. There are even self-inject treatments that a patient can administer in the case of a severe headache. If you've got migraine and you can't control it with over-the-counter preparations, go and see your GP. We have a vast array of medications available depending on the type of migraine you have, the severity of the migraine. We can give more powerful oral tablets. We can even give a self-inject medication to stop a migraine attack in its steps. We can even give medication to prevent attacks coming on if you're getting them very frequently, but your GP will decide on that.
The next presentation will be useful to doctors and healthcare professionals to better explain to their patients in simple terms what migraine is and what the patient can do to limit or even prevent the symptoms. After the presentation, we'll examine the 5 distinct stages to a migraine. More than 1 person in 10 suffers from migraine, a complaint that can have a serious impact on daily life. Migraine, therefore, is more than just a headache. In this presentation, we explain exactly what migraine is and what you can do to limit or prevent the symptoms. Migraine is a complaint that is connected to a severe form of headache. A migraine attack often starts as a dull headache, which then develops into a throbbing or pounding pain, mostly on one side of the head. This pain can spread further to the neck and shoulders. With a migraine attack, other symptoms can also occur, such as nausea, vomiting, and a hypersensitivity to bright light, sound, and even smells. With some patients, a migraine attack begins with an aura. That is the generic term for a number of neurological symptoms such as flashing light, hallucinations, or other sight disorders, but also sensation disorders, paralysis symptoms, or even speech disorders. The aura usually disappears shortly before the headache occurs, or sometimes it merges with it. The exact cause of migraine is still under research. We do know that migraine is a neurovascular complaint that is related to an overreaction of blood vessels in the brain. Migraine occurs more with younger people than older people, and more with women than with men. Furthermore, the complaint is hereditary. Migraine patients often know other family members who also suffer from it. Migraine attacks can be provoked when specific factors or situations arise. Such a factor is also known as a trigger. Examples of triggers are specific types of food, drinks, or environment factors. Triggers are very individually determined and vary from patient to patient. For some migraine sufferers, alcohol, stress, or menstruation can be triggers, while for others it might be coffee, chocolate, or a certain smell. So as a migraine sufferer, it's very important to know your own triggers. Due to the fact that each migraine is different, there are various ways to treat or even prevent migraine. In order to limit the seriousness, length and frequency of a migraine, a regular lifestyle is crucial. Eat, sleep and move regularly. It's also important to avoid or limit stress. Migraine sufferers can also get to know their personal triggers and then learn to anticipate them. In addition to good hygiene, medicine can also be prescribed to treat or relieve migraine. There is acute and preventive medication. Acute medication fights the pain directly the moment it surfaces. If you have more than 2 or 3 migraine attacks per month, then preventive medication can help to limit the number of attacks and their intensity. Ask your doctor for advice. Migraine can be very painful and can seriously hinder daily activities, so never say just a headache about a migraine. There are 5 distinct stages to a migraine, although not everyone goes through all the stages. Stage 1 is the prodrome or pre-headache. Some people experience changes in mood, energy levels, behaviour and appetite, and sometimes have aches and pains several hours or days before an attack. Stage 2 is aura. Some people experience a sensation or aura just before their migraine starts. Symptoms of aura include flashes of light or blind spots, difficulty focusing and seeing things as if you're looking through a broken mirror. This stage normally lasts around 15 minutes to an hour. Stage 3 is headache. This is usually a pulsating or throbbing pain on one side of the head. You usually have nausea or vomiting and extreme sensitivity to bright light and loud sounds, with a strong desire to lie down in a darkened room. This stage lasts for 4 to 72 hours. Stage 4 is resolution. Most attacks gradually fade away. Some people find the headache stops suddenly after they've been sick. Sleep often relieves the symptoms. Finally, stage 5 is the postdrome or recovery phase. There may be a stage of exhaustion and weakness afterwards. As we have seen in the earlier presentation, each migraine is different, and there are various ways to treat or even prevent migraine. Chronic migraine is diagnosed when a patient has migraine on 15 or more days each month over a period of at least 6 months. Also known as transformed migraine, patients usually have a history of migraine attacks that gradually worsen over a period of months or years. In this section of the programme, we visit John Radcliffe Hospital in Oxford to hear expert views on the treatment of chronic migraine from Dr Paul Davies, Senior Lecturer in Clinical Neurology, and Alexander Green, Consultant Neurosurgeon.
I think everyone knows friends or family who suffer with occasional migraine attacks, but in chronic migraine, these patients suffer migraine that's very frequent. People with migraine use medication for the attack. A lot of people with frequent migraine take daily medication to try and prevent the attacks coming on. And with chronic migraine, we may use these drugs to try and reduce the frequency and the severity of the attacks. But nevertheless, we may run out of our pills, and we end up with people who have what's called medically intractable chronic migraine. It's a huge disability. It's recognized by the World Health Organization as in the top 10 there of most disabling conditions in the world. Indeed, if you're having an acute migraine attack, it's considered as disabling as being quadriplegic. So it really is a very disabling condition that thwarts the lives of many, many people in this country.
Peripheral nerve stimulation is where we stimulate a peripheral nerve using a mild electric current. We insert an electrode around a nerve in order to block the signals from that nerve. So the usual situation in a patient with pain is that there are abnormal signals that are causing that pain, and the electrical stimulation blocks those normal signals. The components of a neurostimulation system for PNS consist of 3 main things. There's the electrode or the lead, which delivers the current to the actual nerve itself, and that's implanted underneath the skin in the area of the nerve. That's then connected to something called a neurostimulator, which is like a cardiac pacemaker that delivers the current and has the battery and also is the computer behind the stimulation system. And that neurostimulator is then controlled from a patient programmer, which is a device, an external device that's used from the outside that communicates with that stimulator and alters the various parameters such as the voltage and the frequency.
A good candidate for PNS of the occipital nerves will be a patient with chronic migraine. This will be someone who's been correctly diagnosed according to the definition of chronic migraine, which is headache on 15 or more days of the month, of which 8 or more of those days must be with migraine, and this pattern will have been established for at least 3 months. These correctly diagnosed patients will have tried all our available or all our reasonably available medical treatment. They will have failed preventative treatments. They may be overusing acute medicines. They may well have tried Botox treatment, but if they've failed those, then these will be suitable patients to put forward for PNS stimulation of the occipital nerves.
The PNS procedure involves putting a lead, or 2 leads usually for migraine, over something called the occipital nerve, which is at the back of the neck. So what that involves is either a general anaesthetic or a local anaesthetic. We can do either. We make a small cut in the back of the neck with the patient lying on their front, and we just tunnel a small area over the nerve at the back of the neck and just insert the electrode. If they're awake, we stimulate it at that point, and they tell us whether they're feeling stimulation or not. And then when we put 2 leads in place, we then tunnel it to the neurostimulation device, and we put that into a small pocket just with a little cut, usually in the chest wall, but it can be elsewhere. And then we suture up the wounds in the usual way. And that procedure takes about 40 minutes or so, sometimes an hour, but it's a relatively quick procedure. So after the procedure, the main thing is that the patient has to get over the procedure, which is no big deal, just a bit of soreness around the wounds. And then we program the stimulator, usually the day after. We'll start programming. And we'll try several different frequencies and voltages in order to get that stimulation right. And it's really a case of trying out those different parameters until we get the right one for that particular patient. So they do vary a little bit. The benefits of PNS therapy are that you have a device that hopefully helps your headaches but doesn't have the side effects that some of the drugs that are used for migraine have. So patients who have refractory migraine are often on some very powerful pain-killing drugs that can have some quite nasty side effects. And the advantage of PNS therapy is that you don't have those what we call systemic side effects, so effects that affect other areas of your body, if you like. The other benefit, potential benefit of PNS therapy is that the patient can reduce medications, so they don't have to take medications as much. That's cheaper as well. It's less time consuming. So there are a number of advantages. The best way to get access to PNS therapy is to go and see your general practitioner, who will refer you to a headache specialist. The headache specialist is an important step because they will know what's causing your headaches and what type of headaches they are, and they'll make sure that you've tried every other treatment before you have surgery. If they feel that you're suitable for peripheral nerve stimulation, they'll then refer you to either a neurosurgeon or a pain specialist who specialises in this sort of technique. And then they will see you and decide whether you're a suitable candidate.
Life for patients with previously medically intractable chronic migraine who've had PNS therapy for their chronic migraine can be transformed. These patients will have sought medical treatment over many years and by definition will have failed this treatment, and then suddenly a new treatment can make a transformation in their lives. From being perhaps out of work, they can now go and see work. From being unreliable people, they can be people who are not going to put things off on account of their migraine. It can make a huge difference to the quality of their lives.
In the final segment of this programme, we'll take a look at an innovation utilising smartphone technology to help migraine sufferers to keep track of potential migraine triggers. Please be aware that while we showcase the My Migraine Triggers app, there are other migraine-related apps available from Google Play for Android devices and the App Store for Apple devices.
From the moment you wake up in the morning, life is busy. As a migraine sufferer, I know how an attack can disrupt your entire day. The hardest part is understanding which of the many things you do is causing your migraine. It's not surprising that in a recent survey, 93% of women want to better understand their triggers, but only 11% of women currently track potential migraine triggers regularly. The My Migraine Triggers app makes it easy to track potential migraine triggers on a daily basis, whether you're currently suffering from a migraine or not. You can track everything from your morning jog to the working lunch at your desk with the easy-to-use click list, or by simply adding your activity, food, or beverage. And because anything could trigger your migraine up to 48 hours before the onset, it may help to track your activities daily to see the big picture. And you'll be able to see all of your information visually, with charts and customized lists, giving you another way to identify potential triggers or patterns. With the ability to easily print or share your information electronically, the app can help you and your doctor determine what could be triggering your migraines. Download the My Migraine Triggers app, available free on iTunes, developed for the iPhone and iPad by the makers of Excedrin.
Migraines can severely affect the sufferer's quality of life. During and after a migraine, some people need to stay in bed for days at a time. However, as you have seen, there are effective treatments and methods that can help to prevent migraines. Most people can find ways of managing their migraines so that there is little disruption to their lives. I'm Georgina Burnett, and you've been watching NHS Advances in Migraine Treatment.